One, go.
A good day to you all. My name is Dr. Rosslyn Ngugi, and today we're going to talk about a very important topic, macrovascular complications in diabetes. However, I hope that as you're watching this is not before your dinner or your lunch, because I might kind of put you off by the end of the story. Now, diabetes. Why is there such a fuss about diabetes now? There's even more talk about diabetes than there is about HIV, simply because of our kind of lifestyle, our habits, and the fact that now we've got more diagnostic techniques to be able to diagnose diabetes. Diabetes basically means elevated glucose levels in the body, and this is because of deficiency of a hormone called insulin. Now, insulin is required to be able to control the glucose entry into a cell for it to be able to function, be it in the skeletal muscle, the brain, and other parts of the body. Now, we have two types of diabetes. There is type 1, which is seen in about 5 to 10% of the population, in which there is a complete lack of insulin, and hence these are the patients who are now prescribed for insulin injections for the rest of their lives. But the caveat being that now with the advent of all this technology, we might have actually an artificial pancreas, so look out for those who have type 1 diabetes. As opposed to type 2 diabetes, which is found in about 90 to 95% of the population, and this is characterized by a relative lack of insulin and insulin resistance. What do I mean by this? That we still have cells in the pancreas that are producing insulin. However, for insulin to be able to function, the cells are not quite ready to accept this insulin to allow the glucose to enter into the cells. And as such, we require medication to assist insulin to be able to function effectively. Now, the reason why we are focusing mainly on the macrovascular complications is because it's the commonest cause of mortality. That doesn't mean that there are other complications that don't occur with diabetes. There are two types. There's the microvascular and the macrovascular complications. Now, microvascular is basically when there's affectation of the small vessels of the body. That means the small vessels of the eye that gives you diabetic retinopathy. If it affects the nerves, it's diabetic neuropathy, and if it affects the kidneys, then it's diabetic nephropathy. But that's a topic for tomorrow or probably another day. Now, the macrovascular complications is when it affects the large vessels of the body. That means it affects particular organs without which we would have quite a big problem. It would affect the quality of life. That means the large vessels of the brain, and that can result in a stroke. If it affects the large vessels of the heart, then it can result in one chest pain, which we call angina, all the way to a heart attack. And if you do survive that, and it affected quite a large portion of your heart, then you can end up with heart failure, for which you may require a heart transplant. And as well as affecting the large vessels of the feet, such that you get something called peripheral vascular disease. I will discuss this in detail later, but let me talk about what is the pathophysiology behind this macrovascular disease. What basically happens is a process called atherosclerosis. What does that mean? I break it down to you. Athero means fatty, sclerosis means thickening. So basically, there is fat deposition within the vessel wall, and there's thickening. So you can imagine there's narrowing of this lumen. So where before the blood flow was quite good, now there's actually a narrowed space through which the blood can be able to pass on to supply to the rest of the body. So what happens is, as you go on, what with the different risk factors, which I will discuss later on, what happens is there's a tear in the inner lining of that blood vessel. And what happens is this fatty deposits actually leak into the blood, and when that happens, it causes occlusion of the blood vessel. And one of the effects you feel, if it's in the brain, is that you go to sleep, and when you wake up, one side of your body cannot function. You cannot move. You can imagine how scary that is. Now, what if it happens to your heart? Now, this is what is most scary about it. Now, ordinarily, if you are having a heart attack, you'll feel this crashing retrosternal chest pain, for which you know that you're having a heart attack. But in diabetic patients, you actually do not feel any pain. 1 minute you're well, and the next minute you've actually collapsed, and your relatives are wondering what's going on. And this is why this is important, because we do not want you to end up with a heart attack. If it does affect the legs, then what actually happens is, initially you start walking, and where before an elderly lady would go to the market and she would go do her shopping and come back home, Now she actually has to rest after 15 minutes. As soon as she rests, she feels so much better and she thinks, oh, there's really nothing to worry about. But with time, even when she's resting, she's actually feeling pain. And this is called intermittent claudication. Why is this a problem? It means that you have diminished blood flow to the legs. And with time, what happens is that you can end up getting ulcers and wounds, and later on you end up getting gangrenes, for which you'd end up getting amputations. And you know that definitely affects the quality of life. So now that we've talked about the macrovascular complications and we are together, what are these risk factors and what is the big deal about it? It's because diabetes actually magnifies these risk factors. You know, the thing about diseases is they never actually listen or read books now, where before we were taught that if a patient has hypertension doesn't necessarily mean they have another condition. What we are finding is that most of the cases who have diabetes tend to be obese, they're hypertensive, they have a very poor diet, obviously a sedentary lifestyle with a 9-to-5 job, and at the end of the day, the last thing you want to do, if it is like me and my kind of job, after I've seen 50 patients, all I want to do is put my feet up. That is not what I should be doing. And then with the stress of life, naturally you have a husband who's demanding food and a baby who's crying all the time. Yes, the stress in itself is enough to make you get even a heart attack. And with that, one ends up smoking. So you see all these bad habits kind of pile on top of the risk factors. So how about we control these risk factors so that we prevent these macrovascular diseases? Now how do we control it? It's as easy as A, B, and C. What is that? A means control your sugar. You do a test called HbA1c, which your healthcare practitioner tells you to do once in a year. Or if it's well controlled, then it's a good idea to actually do it twice a year if you can afford it. It checks the sugar control over the past 3 months. Now before, I would have patients who come, and when they know that they're coming to clinic, what they do is that they'll inject themselves and take their drugs 3 days before, and I find perfect sugars. What do I mean by perfect sugars? If it's a pre-meal sugar, it's between 4 to 7 millimoles per liter. If it is after I've had a meal, then it's about 8 to about 10. And because of this, I would naturally say you're doing well, you're perfect. In fact, I've never seen such a good patient. You should be the advocate for the rest of the patients. And yet, a month down the line, I'm admitting you for a stroke, and I wonder, where did I go wrong? It's simply because you were cheating, and yet you're not listening to your body. Don't cheat. Don't lie to yourself, because you actually are lying to yourself. Control your sugars. Monitor your sugars at home. Come and do this HbA1c, and if you're told that it's less than 7%, then you're perfect. However, if it's an elderly patient, then we're not as stringent, and we'll say 8% is good to go. What about the B? Control your blood pressure. What do I mean? Monitor the amount of salt that you're taking, and then the portion control, and you're exercising. And you take medication. Now, if you are exercising, we advocate for 30 minutes a day, 5 times a week, and that comes to about 150 minutes. 150 minutes, you say, that's too long. No, not quite. How long does your shortest comedy take? Half an hour, doesn't it? It's just the time it takes to watch one segment of a season. So surely, if you're a fan of Big Bang Theory, I think that you can be able to just wait for just half an hour after you've exercised for you to watch your episode. And see, cholesterol. It's all about what you eat. Now, whatever we see in the supermarket, honestly, they tell you that it's fat-free and all. Unless it's a polyunsaturated fat, then really it should not be entering your body. I know I'm an advocate for eating healthy, and I'm still in the process. I'm getting there. So take my advice, since I'm not using it currently, but we are trying. Now, if you control your ABCs, and then you stop your bad habits like a sedentary lifestyle, and you stop smoking, then I think honestly you'll be controlling your sugars better than I possibly can. So listen to your body, listen to your practitioner, and you're going to live for another 50, 60 years, which I think you want to do, to live long enough to see your grandchildren. Thank you so much for watching, and I hope you've enjoyed this.